for you. The number one tip for making a good impression as a dentist. Okay. So just to give you an overview of what I'm going to start with, some of the basics of perception. I find it fascinating. We all think we're fantastic at whatever we do, but we've got a human brain that has evolved to hunt and collect berries and do all sorts of things. We were not designed to live in the modern world that we live in from an evolutionary perspective. So our memory is faulty. Our imagination is even less reliable. So our predictive powers as regards how we are connecting with people or how things are going to happen. My background since 1996, I mean, like my original background, I started off as an actor. And then I got into doing something called stand-up comedy, and somebody was saying to me yesterday, "Are you insane?" And partially, I don't like to say, "Oh, we're crazy." We're not crazy, but we really want to figure out what it is to make people laugh. It's a serious business, because you have to put yourself into the minds of an audience. And not just one audience, but several audiences in different rooms, in different settings, at different times of the day, at different days of the week. A Tuesday audience is different to a Saturday night audience. So you're constantly trying to think your way into all of these different situations. So I'm hoping to give you a feel for that throughout the next 20 minutes or so. Then I'm also going to speak about word of mouth. This is a book that I'll be coming back to, which was produced by the Dublin Dental Hospital. Denise McCarthy and Leah Mills were the editors. And it's where it was a mix of staff and patients at the hospital came together to write this book. So there is a number of impacts there. The number one is that it's giving information for future patients coming in to give them background as regards what the cancer treatment journey is like and what to expect and what things help and what things hinder. And number two, it gave an opportunity for patients and staff to give a voice to the event. So it actually created a kind of communicative cohesion and an exploration of ideas as well. The key thing I want to talk about is this idea of stakeholder involvement and engaging a stakeholder experience for the patient. And why I think that's going to be important is how it affects compliance and motivation in terms of how patients will look after their teeth, look after their general health. At this stage, I'm 46 years of age. There's no gasp, sorry. And my sense is I am not my own person, in the sense that there is a part of me, I have to be responsible to all of the people who have kept me alive over the years of treatment. So it's that sense of not being controlled in any way, but a sense of like I owe it to other people to look after my teeth. I owe it to other people to make sure that their work hasn't gone, you know, for nothing. And that includes my mental health as regards how I cope with events, and my physical health, how I look after myself and keep myself in excellent shape, as you can see. Then I also want to talk about the area of public health. Public health is, as we say in the mental moral science business, hospitals are like the ambulance at the end of a cliff, at the bottom of the cliff. Whereas public health is about being preventative. It's about getting out there and communicating. I'm involved with other organizations with this. And I keep saying to sort of like that group, which is mostly physicists and radiotherapists, that you are up against a field of advertisers and marketers who are trying to shove as much crap into the public as possible. They want to convince them to buy products. They want to convince them of this lifestyle. And somewhere along the way, there's also a whole load of myth and mumbo-jumbo that's mixed in as well. The only chance that the public really has of being saved somewhat from this kind of noise and the detrimental effects that it will have on their health, is the public health messages coming from the dental community, from the medical community, from the radiotherapy community. So I want to tell you a little bit about that, and I want to tell you from the point of view as a patient, I am giving you permission. Please tell me what to do. Please step in and join in on the public discourse and start myth busting and start knocking down people who are just putting bad information into the public domain. So finally, we'll have suggestions and discussions. I think this kind of format here, I'll go through my presentation, but I want to get through it as quickly as possible so that we can actually have some kind of dialogue with the audience. So feel free to join in on the Q&A. So I think, first of all, just starting off there, the first impression, you can have a good building. It's neat for patients to walk into, and it is all about the first impression. I'm very glad that I was speaking to a man who had a very significant role in the Dublin Dental Hospital, because I remember going to the Dublin Dental Hospital prior to Brian taking over there as CEO, and it was a pretty dull kind of place to go to, and the reception staff, I can tell you, were special, not in a good way. But this was pretty standard in a lot of places. And this is the kind of stuff that can erode your sense of, oh God, I'm coming in here, what am I being treated like? But this is a very tough job. Dental reception, I know, is probably not as demanding in some respects as GP reception. GP reception are probably dealing with all sorts of very difficult socio-economic people with all sorts of, they're meeting people probably at their worst when they're arriving in there. Whereas dental reception, I'm sure there are problems in there as well, but this is a damn tough job in my view, because there's a huge amount of administrative work to be done at the same time as also dealing with patients who are always self-involved. People were always self-involved whenever we go to a desk, be it at a dentist or an airline or wherever it might be. So there, the message is tough job done well. So that's very important if anybody's involved in dental management, just to get these things right. Delays and the information limbo. I traveled here from Prague with Czech Airlines, and I experienced all of this, and it is one thing that just gets me going. Give me an explanation and probably offer me a drink of water and I'm sweet. Leave me in the dark and not give me information, and I will be reading you EC Regulation 261, and by the way, you owe me this and you owe me that. I really cannot abide being left in the dark and not given any explanation. Like, it's okay. Once I get an explanation, I can see, right, now I can reconnect. But when I'm not given that information, I'm going, the people inside might be thinking, I'm busy, my service is popular, I'm doing my best, I'm seeing more patients, we don't turn people away. And that's all very reasonable. People are doing their best. But really what the patient is getting while they're sitting there on plastic seats that are uncomfortable, their back is aching, their parking meter is running outside, they know they have to go and pick up kids, or they have to get back to a meeting or get back to work or whatever, and they just get the message, disorganized, indifferent, contempt, disrespect. So it's even just any sort of like, by the way, we'll be with you in a moment, it takes very little time to do it, and it can calm people down. They had when you go to a bus stop and they now have signs and they tell you how long your bus is going to be. What a relief. I mean, like, you know it's late, but you know how late it is, and it calms you down. So it's a very important part of communications. So it's about giving information about delays, having a DNA policy as regards people who don't show up. I think it's important to communicate this as regards how much time has been lost, what it means, giving people information, a number to ring. I think one of the things that they don't do at the dental hospital, or they don't do it at my GP service, but I believe it can have very interesting impact on compliance, is getting patients to actually write down the time of their appointment, to write down the details on the card. So you hand them the card, you give them a pen, they write it down. It sounds shockingly counterintuitive. Why should that have any impact? But if you read, there's a book that I'm going to be telling you about later on called Influence. And they show you did you ever get those product competitions where they say, write down in 20 words or less why you think Bingy Bongy soup is the best soup you've ever tasted? The marketers know what they're doing because they're getting you to use a pen and to write down something positive about this product. It's not about a competition, it's about getting you to make something that you now have to be you can't be cognitively dissonant about it because you've written it down. You've made the effort to write down Bingy Bongy soup is the best soup I've ever tasted because it tastes like country vegetable or whatever it might be. But that is part of getting compliance going. So I'm just suggesting that that's something that you could consider looking into. Of course, I get texts and emails to remind me of things. That's always useful. Another area that I'm beginning to look at now is the idea of the provision of literature. If I see literature that's just telling me the obvious, like don't forget to brush your teeth twice a day. I know for some people it might be complicated, do that, and I'm not ruling that out. But if I'm getting information, I want to be surprised by something that I get in that leaflet. I want it to ask me questions. I want it to get me thinking about things. I don't want it to underestimate my level of knowledge of dental care. I want to get something surprising. And the non-verbal, of course, all of that is covered in just a general way how people approach you, how they communicate with you, how the seats are set up, how the reception as a sort of like a friendly staff, all of those things are covered there. That's the Dublin Dental Hospital. So it used to be this old Victorian building. This is a new section that was added onto it. You can see it's quite modern. It's just on the southwest end of the campus of Trinity College in Dublin. Plan Mechanica, have a lot of their equipment there. And this is word of mouth that was produced there. The interesting thing about word of mouth is that when it comes to head and neck cancers, oral cancers in general, the automatic public perception would be it's got to do with alcohol or it's got to do with smoking. Primarily would be smoking. But the interesting thing about this book is that it brought forward so many cases of people who were young, fit, healthy, didn't run, or were cross-country runners. Some were, very, very healthy, no tobacco, very little alcohol, if any, and yet they ended up with these bizarre tumors. And because they were so fit and healthy, they were harder to detect, because if somebody comes in and they're a smoker, you think, okay, right, I'll check for this. It could be this. But when somebody walks in and they're otherwise healthy and they don't smoke, well, then people begin to think, oh, no, that's probably just something it couldn't be that. But there were so many cases that showed up in the book where it was exactly that. So we have expressions that you can find throughout the book there that talks about this, the whole idea of getting diagnosis in the first place. I went to my GP in 1993. I had a pea-sized lump here at the back of my left ear. And I had this, whenever I drank juice or anything like that, I got this shock reaction coming out of my mouth. And I said it to her, and she looked at me as if I had two heads. And she said, I don't know what that could be. It could be just one of these things that, flu season, maybe its lymph glands just come up and they come and go. I came back to her 3 months later, said the same thing to her. And because I had gone to secondary school and had done biology, I said to her, I think there might be something wrong with my salivary glands. And she looked at me like, the look was, how dare you? How dare you? She says, it's too far back to be your salivary gland. So eventually she sort of says, oh, well, suppose I'll send you to the hospital, get a checkup. So I waited another few months for this and went across, and it turns out it was my salivary gland. It was adenoid cystic carcinoma. And I wasn't told that at the time. I was passed on to a general surgeon. He did a superficial parotidectomy. He said, I'll talk with a radiation oncologist and we'll see whether you need any follow-up. I was told a few weeks after the operation, you don't need follow-up, you're fine, go on ahead. We keep an eye on you 6 months, 4 months, for the first couple of years, and then every year after that. So what I'm trying to get across is that patients come in, they report, they come back again, they report, it doesn't get picked up. And it happens. And it was only when I started working on this book and started talking with other patients who had similar circumstances that I realized the prevalence of how it just gets missed, or it gets misdiagnosed, or treatment is delayed. And then when you get treatment, you're seen by a surgeon as opposed to a multidisciplinary team where your follow-up, because once the operation is done, you're already in the game, where it's no longer possible to just get radiation therapy if that's meant to be the more appropriate way of treating it, or whether you need to have more aggressive treatment with the ENT surgeon. So there are so many issues that I believe that dentists can have a significant role in promoting proper treatment of these crisis conditions quickly, identifying them. I'm just going to read a section here from the book as regards dental care. It's a paragraph just to give you a feel for what goes on. Good dental habits are essential. Head and neck cancer treatment generally has an impact on teeth. I quickly decided that the days of lax dental routines were over. Radiation, for example, lowers bone density. Dry mouth and/or reduced saliva means less protection for your teeth, and your teeth will need all the help they can get. Habits take a week of effort to form, and after that, they make life a lot easier. So go for it. Awaken the obsessive-compulsive within. It will make life easier in the long run. What seems like healthy drinks are not always so good for your dental health. If you drink fruit juices or eat acidic fruit, make a point of rinsing and washing it down later with a glass of water. Do not brush your teeth until half an hour has passed, as acidic fruit can temporarily soften the surface of the tooth. The same goes for red wine. So these are so many things that were not provided in terms of information. And this is very vital information that people don't understand as regards they drink a glass of red wine, they're watching the TV in the evening, they eventually switch off the TV, they go upstairs, they brush their teeth. They rinse with water, they spit out all the toothpaste, they go to sleep. What most people don't know is you drink the red wine, rinse with a glass of water, swallow it or spit it, wait, go upstairs, brush your teeth, spit out the excess toothpaste, and leave the rest on. Don't rinse with water. Leave that fluoride on there overnight. There's nobody I've met in my public discussions with people who actually know that. And yet it can have a massive impact on dental health. So, going back to the dental hospital, the important thing is things like Terabyte, which was provided for doing jaw stretching as opposed to using wooden sticks. The use of fluoride trays, the use of dental guards for biting and things like that. There was a general spirit of communication, discussion, which is very important. Because again, you're sort of like getting all the information, you're asking questions, you're clarifying things, you're finding out things that you would not have known. And I think that that's very important on those interactions. The other thing that I would say is that because of facial paralysis, it's always a problem as regards being able to get, equipment in there, opening. But another thing that happens is that the lip here, for example, cannot get out of the way. So essentially, I have to tell people when I meet them for the first time and they've never operated or done anything around in there, be careful not to catch with this. So I think it's important that if there are patients who have had Bell's palsy or any kind of paralysis or any kind of jaw restriction, that it's very important that, most people will not tell you. They won't give you the information. They assume you know. That's the danger with patients. They assume, so many practitioners know, it must be on my chart, they must know, and it's only when you've nicked them or injured them or hurt them that the information comes out. Compliance and motivation. I don't need to tell you this. Patients will tell you all sorts of nonsense. They will give you information. They'll say, of course, I floss and I do all of that. And you know it's not true. And providing leaflets that just tell people to be good, that's not going to do the trick. It'll give you the illusion as public health, as part of your public health remit. Oh, well, we've given them the information. But that's not the way it works. Human beings, as I say, human minds, evolved brains, they don't work that way. You give people information, we get so much information, but we've only got so much attention span to focus on things, and that's why we need to start working and specializing in the area of habit forming. There's a few books here. I'm only giving a sample of 4 books here, but I think that this is one of the. It's very entertaining to read. He'll be able to explain to you how people try to manipulate all the time, be it marketers, be it politicians, other influencers, and how they are using these techniques. So he's a psychologist, and he's able to say things, a very simple thing like just writing things down, like I was telling you earlier on. Where does it come from? Well, they know that when you had prisoners of war being kept in Chinese prison camps or in Korean prison camps, and they wanted to have, say, a chocolate bar, they had to go and do an essay as regards why the communist system was better than the capitalist system in America. And by writing down this essay in order to get a packet of cigarettes or to get the chocolate, this is how the brainwashing worked. It wasn't forcing people. It was just saying, if you want this, do this. That's why it was so difficult when they got back to the United States afterwards. Because cognitive dissonance means that you want to be consistent in what you do. And you can't, on the one hand, write down an essay talking about, well, maybe the communist system wouldn't be the worst thing to have, or maybe our system of capitalism isn't the best system to have. It's very difficult for people to do that then afterwards. So that's a malicious use of compliance. And what I'm promoting to you is the idea of using a positive public health pro bono or pro benefit version of the information that's in a book like this. There's another one, of course, Nudge, some of you may be familiar with. Simple things like how you organize a canteen, for example. That you put the good food first, make it harder to get at the nasty stuff. And you start seeing that you're encouraging people just by the way you structure how the provision of the healthy stuff is more accessible, and therefore people are going to be more compliant. There's another book there, Succeed. We were having a discussion about this yesterday. And that is a book that I think, if you're talking about, in the education field, any of these books, I would encourage people who are designing curricula for dental students or any students, that you give them at least one module where they're covering books like Succeed, about motivation, influence. Certainly something like Succeed will describe that we are not always motivated the same way. We have a more dominant style. You can test your dominant style of motivation. Some people are motivated by going for the prize. I will achieve this and it'll be great and it'll feel good. And others may be more dominantly motivated by, if I don't do this, oh God, I'll be in big trouble. And that motivates us. I mean, I tend to find, I like to think, oh yeah, I like to go out and, win things and do this and achieve this. But so often, what happens is that I say, well, if I don't do this, that won't happen, and then I'll be in big trouble, and those people will be very annoyed, and that will get me to do things. It's not that you're one or the other. You tend to be dominant in one, but also it changes according to time. If somebody told you, I want you to have a paper on this conference in 3 months' time, and you might say, yeah, okay, I'll have a paper in 3 months' time. And you'll sort of say, well, this will be interesting. I'll get up and I'll give my paper, and it'll be great. And you'll be imagining, well, this will be a good sense of achievement. It'll be a great way to revise what I learned at this conference. But I come back to you a week beforehand and ask you how you feel about doing that. And it will be, I better do it, I look ridiculous, I look lazy, I look whatever. And all of the negative motivations will be coming into play the closer you get to the event in time. But I think it's important to know these things. They're good for 3 reasons. Number 1, it will be good as regards developing ways to motivate patients. Number 2, it will be good in terms of from the student's point of view, just from their own personal well-being and understanding how they manage their core studies and things like that. And number 3, coming back to the main thing as regards public health discourse, I think in terms of engaging in public health discourse and in the public discourse in general as regards good dental care and good health, I think it's important to be well armed with the tools that are being used by the marketing industries, the advertising industries, the other ones that are selling alcohol, beer, tobacco, sweets, sugar, etc. Sorry, I wanted to just talk about this book here, Alan Carr, The Easy Way to Stop Smoking. Whether you're a smoker or not, I think it's a great book to read. If you want to try and help patients who are smokers to begin to take a look at smoking cessation, it's a fantastic system. Many people talk about nicotine. Oh, it's so addictive. In this book, he's talking about, well, no, it's not. It's not as addictive as people think. People think that the problem is nicotine. So much got to do with smoking is not the nicotine. The nicotine's out of your system within 48, 72 hours. It's not that addictive after that period of time. It's highly addictive, obviously, how it works in the body, but that's not what keeps people smoking. What keeps people smoking are all of the associations. I have a nice meal. Well, it's not complete without having. I have a drink. Well, it's not the same without a. So it's all of these kind of things that are far more important. So it's about being able to understand that it's not just enough about putting a patch on the arm and hoping, well, now you have your nicotine, now it'll be fine. It's about changing the click-whir mentality, our automatic brain, our habitual brain behaviors, becoming